and I have embraced three-dimensional technology relative to dental implant placement and restoring teeth with implants, and even restoring natural teeth, understanding the three-dimensionality of teeth. X-rays are just a two-dimensional picture of a three-dimensional object. They give you height and width, but no depth. When we have a scan, a three-dimensional scan, we get so much more information to help plan cases. And we started in 2006 with training on three-dimensional softwares, and now we actually teach other dentists how to use those softwares to help plan their cases.
We embrace three-dimensional planning because actually our history with implant dentistry goes back to the late 1980s, when the dictum at that time was, well, we'll just put the implant in the bone and we'll restore the tooth. Well, we would go to all the surgeries. Implants didn't end up anywhere near the position where we really needed them to be for restorative purposes. So when we were exposed to the ability to visualize the three-dimensional problem of what an implant is prior to any scalpel or any drill being posed to a patient, and be able to conceptualize not only the implant placement, but the desired tooth position. And that's the key point, is being able to match what the desired tooth position for that implant restoration and marry it to the position of the implant into the bone before any surgery is done, elevates your predictor of success and your outcome tremendously. And that's where we thoroughly embrace three-dimensional planning, from using computer CT scans, but also using computer-generated surgical guides that help us to place the implant exactly where we virtually planned it in our 3D planning software.
So the term used for this concept is reverse engineering. And we use the aesthetic parameters to figure out where the teeth need to be. Then we can actually make a mock-up of that and scan the patient with our desired tooth position, and then reverse engineer the process and decide where the implant needs to be relative to the ideal tooth position.
So the mistake that is so often made is that the dentist doesn't take the additional step to analyze what the parameters, what the shape of the final tooth needs to be. Or the implant goes in, it looks great, and the patient says, well, what about the other teeth around it, which would have influenced the position of the implant? And so what behooves us to do is what you can't substitute for, proper planning. And part of proper planning in implant dentistry is proper three-dimensional planning.